Hello everyone, welcome to sqadia.com. I'm Dr. Hamna Iftikhar, and today's lecture regarding gastroenterology is a very interesting one, which is called as cholelithiasis. This is the part 2 of the cholelithiasis lecture, part 1. Cholelithiasis is a very common disease among the Western population. There are around 200 million cases of cholelithiasis among the Western population, and 1 million cases are diagnosed every year. So it's very necessary to know about cholelithiasis. So we'll be talking about this in detail. This is the outline of the lecture. We'll be talking about the different types of complications regarding the gallstone disease. Firstly, we'll be talking about choledocholithiasis, which actually is the formation of stone within the bile duct. So the stone might come from the gallbladder through the cystic duct into the bile duct. So bile duct stone is known as choledocholithiasis. We'll be talking about that in detail. How do the patient present with, and how can we treat the patients? And then we will be studying about the different types of techniques to diagnose the patient with choledocholithiasis, such as ERCP, which is also known as the endoscopic retrograde cholangiopancreatography. We can also diagnose these patients with the help of endoscopic ultrasound. These are the images, and I'll be explaining these in detail. We can diagnose the patient with the help of MRCP, which is called as the magnetic retrograde cholangiopancreatography. And then lastly, percutaneous transhepatic cholangiography is also one of the ways to diagnose these patients. It's very accurate, and it could be done in case that ERCP is not available or is unsuccessful. Now, next we'll be coming to a disease known as the cholangitis, which is very important to rule out, as these patients, they end up having bacterial infection and end up having sepsis. So it's very important topic. We'll be seeing the different ways to treat these patients. It could be with the removal of the stone, it could be with antibiotics, and ultimately it could also be with the complete removal of the gallbladder, which is the cholecystectomy. Next, we'll be coming to more rarer types of complications regarding the gallbladder stone. Emphysematous cholecystitis occurs because of the presence of some gas-forming organisms. So this is one of the rare complications regarding the cholelithiasis. And then there is another type of fistula forming complication. It causes the erosion of the gallbladder, and it causes a fistula to be formed within the gallbladder. As you can see, there's a fistula in the neck region of the gallbladder. So we'll be talking about that in detail. Next, there's a very different type of syndrome, which is called as the Mersey syndrome. It causes the extra hepatic pressure that is put on the hepatic duct. So as you can see, the stone causes pressure towards the hepatic duct, which causes an extrinsic sort of a pressure towards the hepatic duct. And then we'll be seeing the different ways to diagnose these patients. It could be because of ERCP. And then we'll be studying about a porcelain gallbladder. This is very interesting because it causes changes within the wall of the gallbladder. It causes the calcification of the walls of the gallbladder. So we'll be talking about this in detail. How do the patients present with? What are the different treatment options? So these are the things that we'll be studying today regarding cholelithiasis lecture part 2. We've got thousands of lectures available on our website regarding cardiology, gastroenterology, surgery. You can have any lecture available for you to see, and they're all present on our website right now. You can log on into sqadia.com and start your free trial right away. Thank you for watching sqadia.com.